You've probably heard some version of a stat that caregiving will kill you. Here's a real one. One landmark study found that caregivers running on strain had a 63% higher risk of dying than their peers who weren't caregiving. 63%. But it wasn't the actual caregiving that did the damage. It was the strain of the role, the unrelenting, unsupported load of physical, emotional, mental, social, financial, legal, all of the different factors that are required for navigation in a caregiving role. And what do we do to hand these people to try and help them? 10 minutes to breathe, a walk around the block, a gratitude journal. And look, maybe that buys a little bit of lifespan, maybe a mini reprieve from the chaos of the day, but nobody's asking the real question. Are we actually protecting their health span? Are we actually keeping them well, or are we just keeping them alive long enough so they can keep caregiving? You can't breathe your way out of a system that's structurally overloading you. So this week's questions are, what's the difference between health span and lifespan, and why does it matter for caregivers specifically? Why do caregivers tend to deprioritize their own health and wellness while managing someone else's? What does proactive planning look like when it's for the caregiver and not just the person receiving care? How does that sandwich generation balance long-term wellness with the daily demands of caregiving? Welcome to the Aging Together podcast. I'm your host, Dr. Pooja Ashok Patel, a double board-certified occupational therapist and gerontologist with additional certifications in dementia and fall prevention. This season, we are unfiltered. In this podcast, I interview guests who are experts in their fields or caregivers who are sharing their lived experiences. Let's meet today's guest. Joining me to tackle this topic today is Nancy Griffin, an entrepreneur, connector, and storyteller, using decades of hospitality, wellness, and longevity experience to reshape how we think about aging well. Her work sits at the center of a simple belief. The new longevity is a cultural shift toward age inclusivity, and organizations must lead the way. Nancy leads conversations and partnerships that help organizations rethink longevity, workforce design, and well-being. She hosts the Glowing Older podcast and runs the Contento Group, advising brands on longevity strategy, and created Senior Trade, a B2B platform and e-newsletter for senior living and aging services professionals. Her practical, program-focused work is built to help organizations design age-inclusive cultures, events, and programs to change the narrative around aging. This present-day work is informed by a long career connecting wellness, hospitality, and media, from founding industry platforms to creating community-driven professional learning. Those early ventures taught Nancy how to build networks, translate research into practice, and convene the right people to solve real problems. Nancy, welcome to the show.
Thank you. That was a mouthful. I appreciate it.
That's okay. I'm so excited to hear about your journey and your story and your thoughts around this topic, knowing how much work you've done in this space throughout your career. So before we start, do you have a hot take?
Well, I think one of the things about doing my show, I know that you have your podcast as well. Obviously, I'm on it. We learned from our guests. So in 240 episodes, one of the things that really struck me was just how much ageism, and particularly gendered ageism, as you're probably aware, there are more women caregivers than men in general. So I think that the gendered ageism is real about, in particular, women and caregivers not giving as much time to their own life plan and what they want to accomplish. And I think one of the things, my hot take, is that caregiving sucks you up like a vortex. And you must talk about this all the time. But it's about life planning and valuing that planning, and not letting your ageism and your own internalized ageism get in the way of your life plan.
That's a really interesting perspective on that. I don't know that enough people understand that internalization of the ageism, especially the gendered ageism. I think we talk about it a lot within our industry as providers or as counselors or as consultants, but to really understand if the caregivers self-identify or that internalized ageism, I think that's really, really important.
Yeah, it seems like a lot of times with caregiving, you're valuing the other person and their situation more than yourself. And one of the things that we say a lot at Glowing Older is to wear your own oxygen mask first, which of course comes from the airline spiel. But really, it's so true, because if you don't prioritize your own health, which is really what we're talking about when we come to health span and lifespan. How many years you live is one thing, but how well you live those years is another entirely. So a lot of times with caregivers, when you get sucked into that vortex, you end up on the other end of it when your older adult parent or whatever passes on. And you said, wow, okay, well now I'm depleted. I'm depleted financially. I'm depleted personally, mentally, emotionally, all that kind of stuff. And our thought process at Growing Older is that if you plan, and then of course planning the unexpected comes up all the time, but if you plan for what matters most to you in your later years, given the trends globally about we're living much longer than we used to. There's more centenarians than ever before, and the projections are for that to keep shifting, growing. So if you have 30 or 40 extra years, why not plan for what matters most to you? And it seems to me with a lot of times with caregiving, it's throwing your own needs to the wind in that moment. And as you know, in families, it oftentimes is the oldest daughter, or it's one person in the family, and everyone else abdicates and goes, oh, good, thank you for handling that. But it's often at our own expense. So I think that's one of the biggest takeaways with caregiving is how can we manage our own self-care in the process of taking care of others?
Yes. And in order to be able to do that, you have to learn and know about the resources and the support that's available and the services that are available so that you can add that to your plan and be strategic about it.
Yes. Yes. And we're both in the United States. I'm sure you have listeners from other countries, but most other countries, Japan, Singapore, Korea, Italy, Spain, they have government policies in place to help caregivers, to help older adults, to help the caregivers manage both the younger and the older generation they're caregiving for. But the United States is really one of the toughest countries when it comes to finding policies. So that's why it's so important, your type of podcast, to help people discover the types of resources that they need. Because as we say at Growing Older all the time, aging is a team sport. And in the United States, we tend to have this John Wayne independence, fiercely. Aging is all about how well I can eat and move my body and do all these things. But we really are interdependent creatures, humans, and we need that. So it's really about who's on your aging dream team, who's on your caregiving team, what resources are available to you. And as Americans, we're oftentimes left looking for those resources on our own because there are not a lot of government programs hand-holding us through the process.
I love that you said that because as someone from a collectivist community and culture where it is just norm that everyone steps in to support each other throughout life, we're seeing a rise in multi-generational homes again for various reasons. But, one of these, I love that you said that we are inherently interdependent beings and that this away from having to live independently and be independent even into your 90s. We're not talking about just being able to feed yourself or bathe yourself. We're talking about just living day to day, and that you want to have people around you and surround yourself in community and others without feeling like you're a burden to them.
Yes, and I think the concept of social health when it comes to healthspan and longevity is coming much more to the forefront. We're seeing a lot more studies come out, the longitudinal studies. The Harvard project followed, I can't remember how many Americans it was, for 85 years over their lifespans. And the number one factor to aging well was the quality of their relationships. And so, if you take out all the other factors, smoking, drinking, the way you eat, the way you exercise, all that kind of stuff, take all those factors in. The quality of our relationships is the number one factor of how we age well. So, of course, the social health piece comes into play. And it seems to me you're the expert on the caregiving side of it. But it tends to be isolating. It tends to be lonely, which, as we know from the Surgeon General, can be as dangerous as smoking 15 cigarettes a day. So it tends to be, you tend to feel alone. You don't feel like you have resources, and it can completely affect your health long term, your health span, your ability to live well longer.
Yeah. Yeah, I have additional thoughts on that, on how that correlates also to the caregiver, because as the elders get isolated, the caregivers also start getting isolated. Before we continue using all these terms, can you define sort of what we're talking about when we're talking about health span versus lifespan and longevity?
Yes, well, the word longevity is used, oh my gosh, it's become the new marketing word. I come from the spa and wellness world, and longevity is like literally everywhere. So longevity typically was hijacked a lot by the, Silicon Valley billionaires that were trying to live as long as possible. But the conversation has come up more and more about health span being more important than living long, because if you're living long, the average American lives 11 and a half years with unhealthy chronic conditions. And that's much worse than other countries. Unfortunately, we are pretty down far on the list when it comes to that gap between health span and lifespan. So longevity is becoming more and more in the vernacular globally about living well longer. Traditionally, the word longevity has been like, well, how long can I live? But now it's like, okay, well, we have to have this conversation around living well, because if you're living unhealthy, first of all, there's an incredible financial burden on our governments when people have these really unhealthy conditions. Plus, it affects the quality of your life. I mean, if the quality of your life is about doing activities that you love with people you love, as we become more burdened with chronic conditions, it becomes a lot harder to live our lives well. So that's why I see the spa industry, the wellness industry, the senior living industry, longevity kind of coming together, which is, what steps can I take to live healthfully as I can? And of course, a lot of that has to do with mobility. As we get older, there are things that happen to us. Our sight is not as good. Our hearing is not as good. We lack mobility the way we used to, but it's really about trying to maximize those issues. So women's health in particular has become a really hotbed issue in wellness and longevity, because we have different needs than men, and a lot of the research, clinical trials, all that have been based on men. But as women, we're now starting to prioritize our health, and there's this conversation of what steps we need to take. And the restorative part of the necessity of rest and rejuvenation and all that is something that caregivers will oftentimes just shut you down and say it's not possible. I can't fit that in. I can't get a massage or a facial, or all these things you're talking about are ridiculous. And that's why I think you talk oftentimes about, can I take a 5-minute breathing break? Can I take a walk in nature? Like, what are those tiny steps I can do? But I will say about the health span, lifespan, longevity piece, that in my opinion, it really comes down to small daily steps, and not longevity drugs and all kinds of extreme measures like dipping yourself into an ice bath every day, all those kind of things. There's a lot of conversations around those type of things, but it's a small stuff that matters. What are you putting in your body? How are you moving? What's the quality of your sleep? What's the quality of your relationships? Do you have a purpose? What gets you out of bed in the morning? What the Japanese called ikigai. So it's like those kind of things, those small things are really what add up over time into whether we can match health span to lifespan.
Yes, absolutely. Something that we've talked about a lot on our show is the aging in illness versus aging in wellness, right? I think similar along the lines of what you were saying of aging well versus being ill as you're getting older. And I feel like that should be what longevity should be, of like, how do you age in wellness without having all of these, either chronic diseases or health issues or decreased mobility or any of that stuff, and not just necessarily injecting stuff into your body to make you live longer.
Yeah, well, I think we're coming back to that. There's that Brian Johnson, who's that billionaire Silicon Valley guy who's literally tried everything under the sun. He was quoted in an article in Time magazine recently when they had a whole issue on longevity. And he really came around to, after everything, the quality of your sleep. Number one, quality of your sleep. And so I think that's why we're seeing so many apps. But it's interesting because I think you can take this whole tracking thing that's a huge trend, the Oura Ring and the Apple Watch, all that kind of stuff. I think that can also cause stress. And I think we need to be aware of the fact that that stress ages you. And that's why we talk a lot at Growing Older about ageism and internalized ageism, because if you are so worried about aging, and you're also reminiscing on how things used to be and how I used to run the quarter mile so much faster and how my hair used to be thick and full and blonde and all those kind of things, that is actually aging you because it's causing stress. So I will add that I think in all of this, attitude is a really big part of it. And I think it's very complicated when you're talking to caregivers because you're talking to people that are oftentimes just stuck and don't feel like there's a way out and don't feel like there's anything they can do. So there's a helplessness, which I think contributes to the stress and the unhealthy portion of caregiving because it is incredibly stressful, and especially, as you know, when it comes to any kind of cognitive impairment with a loved one, it complicates the issue and can oftentimes really make people in a state of feeling unhappy.
Yeah, definitely. Sleep has always been one of those things. So in OT, we learn about the importance of rest and sleep, right? And sleep often tends to be the area that gets least addressed across rehab. I think partially in inpatient settings, it's because there's really not a whole lot of control over it, right? There's, especially in the hospitals where I've spent most of my career, there's a lot of things that have to happen overnight, whether it's vitals or labs or imaging, urgency, right? And so we find that there's so much sleep disruption, specifically in patients who are there to recover. And how are we supposed to do that if they're not getting good sleep? And so little things like introducing sleep packs that have, all the earplugs and the eye masks and all of that to help them sleep better. For those patients who really, really need good sleep, trying to take a team approach to saying, hey, can we give them a solid 5-6 hours at night so that they're not interrupted, right? We can only control so much in those environments. But then when we move that into the home, this is where I think people can be so much more mindful about their sleep routines and their sleep hygiene, as we refer to it, of making sure that, you're going to sleep within the same 1 hour window every night and that you're waking up within the same hour window in the morning and that it's uninterrupted as much as possible. And how can you make sure that you're getting a good deep sleep and all of that? And that is especially important for the caregivers who are then going to have to spend all day caregiving, right? It's not a 9-to-5 job that you can clock out of or take a lunch break from. It's constant. So how do we prioritize the caregivers taking care of themselves in that way if they're doing it for the people around them?
I think that it really starts with what you value. Mm-hmm. We talk a lot about this life planning thing, planning for these 30 or 40 years that you're now given, our lifespans, is that it's easy to plan for a vacation. It's easy to plan to join a sorority or pick your college, or these are all things that we value. And so I think at a point, a caregiver has to say, what are my values? And take time to think what matters to me most and how can I fit in those little moments. And oftentimes, I don't want to say that comes at the expense of the person you're caring for, but there has to be a balance. Because if you're 100% for the person you're caring for and you're not prioritizing yourself, you're not doing anyone any good. Because oftentimes with caregivers, as you know, they're not just caring for one person. Oftentimes with women, they're caring for their own parents, they're caring for their husband's parents, they're caring for their children, they're caring for their friends. And women, I think, tend to be caregivers by nature. And of course, there's a lot of incredible men caregivers out there, and I'm not minimizing their efforts. I just think in general, women tend to take on burdens without considering the long-term effects of what they're taking on. So that's why I think it starts with what you value. If you value yourself and what matters most to you, and you plan for it early. When we talk to people, plan in your 30s, your 40s. What do you want in your 60s and 70s? If you have a plan in place, it will change. Things happen all the time. My mom's 82 and she has a friend who's 83. And when I get together with them, they're like, well, we're doing great now, but it's all about wait until that other shoe drops. We don't know when that's going to happen. And so we live every day, living our best lives, but we don't know. So I think we all don't know, what's going to happen. So but having that plan of taking time to begin with your values. We always take people through a values type approach because oftentimes you can have conflicting values. So it's like, well, I love being a homebody, but I also want to travel. It's like, okay, well, what does that look like? How do you manage all these things? So it's opening up your worldview, I think, from your caregiving worldview into all the different considerations for your own life, because you matter. And what you value matters, and what you want out of your life matters. And I think that sometimes caregivers can forget.
Yes, absolutely. There's so much of what you've said that I incorporate into my planning work that I do with families. But I would say, so a lot of my planning focuses on how they're planning care for the individual. So for example, if I'm working with a daughter or a son, we're talking about what the plan is to care for their parent or their spouse. And I can't say that I've spent enough time working on or even talking about what that caregiving plan looks like for the caregiver or the care provider in the family. And so, we're talking about, okay, where do you think you're going to provide care? How are you going to pay for it? Who's going to be responsible? Where is it going to be? We're talking about all the logistical information and then also the practical information of finances, legal stuff, paperwork, documentation, all that kind of stuff. And, I'll tie in a little bit about like capacity, like what is your capacity to care for this parent or your spouse or whoever it is? Do you feel like you have the bandwidth to be able to do this? Especially for those who are managing both parents and kids and have high demand careers or jobs, right? What does that look like? But I don't know that I've spent true time speaking about what this life would look like or what this role would look like for the caregiver and the care provider. And so I'd love to know sort of when you talk about that, what do you focus on? I know you said values, but from there, how do you position it so that the caregiver understands that their health and wellness is also equally valuable and important as the person they are caring for?
Yeah, well, I think a lot of that has to do with roles and the roles you see yourself in. And I think that oftentimes caregiving is fluid. You can be a caregiver and then you can need caregiving. So I think that one of the things to keep in perspective is this too shall pass, and this is a period of time. And because I think that feeling stuck is real and feeling overwhelmed is real. I've heard from a lot of caregiving experts, and I certainly don't consider myself a caregiving expert. You're the expert, and your podcast is addressing what you just said that you oftentimes don't talk about in your practice. People can come to your podcast and get that kind of information. But it's like, how do you identify? Caregiving is just one role. And I think the thing that happens with caregiving is it becomes all encompassing and it becomes your entire identity. And the analogy is it sucks you dry. And I can tell you that I've heard from many caregiving experts too that the people being cared for don't want that either. They don't want you depleted. They don't want you to give up your entire life. If they had their choice, they wouldn't choose that. So yeah, I think one of the things that's so important is having hard conversations early on and talking about different scenarios. If this happens, what will we do here? If this happens, this is what we'll have a plan to do. But I think oftentimes, like the analogy of my mom's friend saying that she's waiting for the other shoe to drop. It's like there's this fear around what could happen. So it doesn't get attention, it doesn't get discussed because it's like, well, God forbid that happens, we won't talk about that. So I think talking about the different scenarios and also being aware of your own needs. And nobody thinks it's healthy for a caregiver to just completely deny their own needs, because nobody wants to come after what they think is going to be 6 months of caregiving and it ends up being 6 years of caregiving, and you come out and you have no retirement because you've depleted your 401k and you have now chronic conditions that you can't manage. I would say that the loved one that you're caring for doesn't want that either. So it's a matter of priorities, right? And it's very difficult, which is why you have these conversations. There's no easy answer. And for me to sit here not being in an active caregiving role saying, well, this is what you need to do, is probably the last thing they want to hear, right?
Right, absolutely. And that's sort of the premise of, as I started talking with these families and talking about the importance of having these difficult conversations about something that's inevitable, right? Like it's one of the only things that is inevitable in all of our lives is that we're going to die at some point. And whether that's quick or requires caregiving, someone is going to take that role on of helping your family through it, right? And so we should be talking about it. And through these conversations, it really came up that people just needed a way to think about these conversations, right? Guide them through the conversations to make it a little easier to have them, to make the information more digestible. And that was what led me to create the workbooks that are available for people online, because it just gives people prompts and gives people scenarios, like you said. What do you want in this scenario, right? Something else you brought up earlier was the lack of consideration for one's own health when they're so consumed by that caregiver role. The number of times I've heard caregivers say, oh yeah, like I'm 6 months overdue for my annual physical, or yeah, I've been dragging my feet, I need to go get this checked, right? And the more they wait, the worse whatever it is going to get, right? And so instead, if it had been tackled earlier, as soon as something happened, like you would in the caregiver role for the person you're caring for, perhaps that would have never escalated to something that now is going to result in a potential chronic debility or chronic illness. And so it really comes down to, like you said, prioritizing, understanding values. And then also, identifying all the different roles that you have. That's the core of what OT is. We help make sure people can maintain their roles and their values and create routines that help support those. I think it just gets lost a lot of times when it's not the person we're caring for, but it's for the family caregiver that's going to be providing that care at home.
Yeah, I think you're absolutely right. One of the things I love about your profession, and I've had many OTs on my show as experts, but you take into consideration the environment, and then you take into consideration the person, and then you make tweaks on both ends to make sure it's a good match. That, I think, is one of the reasons why OTs have really stood out to me as being so important in this whole aging process, because you're also talking to people about maybe moving their body in different ways. And it's not just environment, but it's that match. I think that's so crucial.
I really appreciate that. Yes, it's definitely one of our unique perspectives. We always say it's a holistic perspective on the situation, right? From a personal standpoint, an environmental, a social, physical, mental, cognitive, whatever it is, we try to piece the puzzle pieces together to create a picture that's going to match what the person wants to and needs to be able to do. And I love that you've surrounded yourself with them in this work.
Thank you.
Is there something that I haven't asked you that you wanted to talk about?
Well, what occurred to me when the last things that you were talking about is this idea of aging in place, which I think OTs are such specialists in that. There's the whole aging in place organizations and a lot of conversations on that. And I'm sure that you help people look at their homes and say, is it a practical place for me to age well? And it's interesting. My mother was a book editor, and she edited my show notes for quite a while as I was having all these experts on. And she ended up building an accessory dwelling unit on her property because she said, well, I know that I don't want to move into senior living and that I'm probably going to have to plan for some sort of caregiving. So she built this ADU for thinking about planning ahead and knowing that she is not the kind of person that wants to end up in senior living. So I say to your listeners that are planning for their own aging process, whether they're caregiving or not at this stage of their lives, is to consider all the social determinants of health, of where you live, as not just being the four walls of your home, but is transportation available? Is healthy food available to me? Are there community programs where I can flourish? All those kind of things are really important to consider besides just how to retrofit your home. So taking advantage of an OT to help you through that process is part of that planning, because we say home, health, and heart. So home is where your four walls are and your immediate surroundings, and health are all the different aspects of health and wellness. And then heart is really what matters most to you. And so let's drive it back to that, because that affects that affects all the other pieces of the puzzle. Maybe you want to live on a cruise ship, and maybe your husband doesn't want to travel and you do, so you do solo travel. All those kind of things. The more you start thinking about what feeds your soul, the better.
Yes, that is a great point. And it's funny you said that because my mom has told me for years, she's like, if I ever need 24/7 care like that, just throw me into a nursing home. And being in the industry, I'm like, Mom, I'm never going to do that to you, right? Like, that's not what I'm going to do. But I do think, for the families who can joke about it, it's a great way to have those difficult conversations. For families that struggle with these kind of conversations, I think it really is important to say, hey, I want to help you, help me help you. And I think that can go a long way sometimes with parents because, like you said, they don't want to see you struggle. They don't want that for you, of where you're going to lose yourself and caring for them. It's just a matter of opening that conversation so that you can better understand what do you want so that we can figure this out together.
Nobody wants to be a burden. Nobody.
Yeah, absolutely. Well, Nancy, I think this was such a great conversation. I know we've had similar work in that front. One of the things I wanted to ask you about as we were talking through this is your work in promoting this Healthspan approach for family caregivers and your work with consulting with businesses. Do they overlap and how do you weave that into there?
Interestingly, I just did a webinar with the global VP of wellness for Hilton hotels, and we talked about both what we would call generativity, which is how older adults bring their legacy to the table, and intergenerational travel is a really big trend. And in fact, in India, it's like 80% of grandparents are traveling. They're skipping a generation and traveling with their grandchildren. So there's a big trend towards this intergenerational piece. And then from staffing standpoint with businesses, it's really important to take a look at your workers through their lifespan and understand that caregiving is a big piece of everyone's path in one way or another. So I'm not sure if you're familiar with Wellthy, Wellthy. It's a platform that helps caregivers, and Hilton is part of it, and many, many corporations in the US and globally are taking advantage of Wellthy because it has caregiving resources. And so caregiving is something that a lot of corporations are having to take a look at. And of course, we have an aging workforce. In this country, we have immigration issues going on, obviously, which makes it harder to find staff. We have declining birth rates. So we have less young people coming up as workers, and we have an aging population. So countries like Japan are taking an active stance in making resources for older adults. 25% of the Japanese workforce is over 65. And it's one of the oldest populations on the globe. U.S. businesses are much slower on the uptake when it comes to providing caregiving resources and career paths for older adults. We are an extremely ageist population culture at this point too, but I'm hoping that that narrative will change and that more and more businesses will be taking a look at providing caregiving resources and career path intergenerational activity. Intergenerational relationships are one of the best ways to overcome ageism. And I think that this ageism piece impacts everything. It impacts the respect for our elders. And besides the children piece, older adults are going to be the ones that need caregiving. And if we don't value and respect what they bring to the table, it becomes very one-sided. And I like to say I'm a member of an organization called Connected Horse that does equine assisted training with partners and the people with dementia, and they call them care partners. And I think that's a great phrase to use because it is two-sided, and we do get things from the people we care for as well. There is a joy, but when you're completely overwhelmed and depleted in every way, you can't see that joy, and it becomes very hard, and you become a martyr, which sometimes you can't help. But I'd really encourage our listeners to take some stock about their attitude and how they are looking at this whole process, because you have to have some sort of a positive attitude to get through this. Otherwise, you're going to be sucked dry because it's not easy, right? I mean, there's no way to say that caregiving is an easy path because it's not.
No, it's definitely not. But little things like these and just these conversations with large organizations that have aging workforces, which is across most industries at this point, I think is incredibly important. I've done a few webinars with employee assistant programs or employee resource groups where they're trying to educate their caregiving employees about certain things. And I think that's also been a hard space to get into. Like you said, they're slow on the uptake, and until they kind of understand and realize that they're going to fall behind in this space, I don't think they're going to take the bait on wanting to learn more about it or really understand how to support their caregiving employees in a way that's sustainable for the business and for the employees. Because, and I just recently talked on another show, I had a conversation with someone about the financial implications of caregiving employees for the businesses, right? And obviously, we have the financial implications of caregiving on the caregivers, right? The care partners, the care providers, largely women. And that's a whole conversation in itself. But, when we think about how that impacts the organizations, right? If something happens to that employee and they go out on a short-term or a long-term leave, that's how that's going to impact versus the options for flexible work and how that could impact the organization, right? And so there's so many conversations that I think need to happen. And I'm not sure what that turning point's going to be when they start really wanting to have those conversations. But I think people like us doing the work and just trying to educate the masses is hopefully going to work towards that eventually.
Yes, I completely agree. And, ageism is coming to the forefront. There have been changes. I've been doing my pod for almost 6 years in August. And I can say that there's been more of a conversation about the value of older adults and this whole fountain of youth being silly and anti-aging being outdated and all these kind of stuffs. But at the end of the day, it really does affect a lot of caregiver initiatives because a lot of caregivers tend to be in that, 40, 50 year old where they have the sandwich generation, I think is the most vulnerable really right now when it comes to caregiving, because I've met so many women that are entrepreneurs and movers and shakers, and then you find out, okay, well, I'm also caregiving for my mother who has cognitive impairment or those kind of things, and you realize, oh my gosh, you have kids, you're navigating older parents, you're an entrepreneur, you have a big corporate job, whatever. It's like those kind of things aren't sustainable long term. And I think companies are beginning, like Wealthy, a lot of corporations have partnered with Wealthy and they are just caregiving resources. So hopefully the narrative is changing.
Yeah, no, I agree. And yeah, like you said, I think I don't want to say that social media necessarily glorifies it, but I think there is some semblance of glorification of being able to do it all. And I feel like it is slowly starting to go away, especially with the younger generation. I feel like more and more people are saying, like, we don't need to do it all. Like, let's just pick one thing or two things and just stick to that so that it's not so much when there's other extra emergency situations or urgent tasks that need to be done, you don't end up getting squished so tight. And I think that we might be headed down that too from a workforce standpoint.
Well, we're helping to change the narrative, which is really important to get people to think about these things. On Glowing Older, we have a document you can download on how to have hard conversations with your aging loved ones. And just having some of these conversations, like you said, is the place to start, because ignoring what could potentially happen and waiting for a crisis for action is never the best way to proceed. As humans, we don't function as well in a crisis. And there's all kinds of decisions that have to be made in the moment without planning. So the earlier you can start to think about these things, the better. And we've interviewed at Glowing Older, we've done some coaching with older adults and their adult children. And oftentimes what the older adult thinks is the plan for caregiving is not what the adult child is thinking. I mean, we've had people say, I'm not doing it. I'll move to another country before I'll caretake for, so not having those conversations and assuming is to everyone's detriment.
Yes, absolutely. And I think that is especially true in specific subcultures. In my area of work where I try to really educate my South Asian community about a lot of these topics and this work, it's an assumed obligation that your kids are going to take care of you. And Now we've entered an environment where we have the first phase of the immigrant population from South Asian diaspora that is aging. From all the immigrants who came here in their 20s and their 50s or 60s are now in their 80s, right? And they're starting to need support. And you mix that with the first generation of the South Asian diaspora that was born and raised here in the States with a very different upbringing and a very different culture. And so now you've got these not just generational differences, but cultural differences in how we see responsibility, how we take on some of these obligatory roles from very different perspectives, right? I grew up in a house watching my parents take care of their parents, right? And now I live 800 miles away from my parents. And it's one of those of like, okay, I'm still going to provide you with support. It's just going to look very different from how it looked like with you and your parents, right? And how do you manage those expectations? How do you navigate those discussions if you're not even going to talk about it? And so I talk a lot about that stuff within the diaspora of saying, well, you have to have these conversations. You have to talk about it, because if our parents have expectations and we don't follow through with them and we don't talk about them, we're going to end up doing it out of obligation. But then we're also going to end up building resentment. And then we're going to end up in this really vicious cycle of guilt and stress and all of the different emotions, the negative emotions that come with that.
Yeah. And oftentimes there's that martyrdom with it. Right? Mm-hmm. Where it's like, okay, well, my brother doesn't want to do anything. He's useless. He won't do anything. Well, it's like, okay, well, if you had the conversations and you were very clear with him about what you needed and what he is capable of doing, and, you know, maybe you need to chew it up and put it in his beak a little bit and help him. But oftentimes we'll just be, oh, they're useless. I'm going to have to take this whole thing on myself, which is a woman thing. You know, definitely tends to be, you know, we say in the industry, I'm sure you hear it all the time, the oldest daughter takes the burden. And I think that even conversations among siblings need to happen early. And these are not easy conversations. We, as human beings, do not want to think about dying. But really what's interesting to me is oftentimes it's easier to have conversations about dying with our parents than it is the years up to dying. So we'll talk about, okay, what I want at my memorial service, but I might not talk about what I want to do with the 20 or 30 years I have before I probably keel over, right? So it needs to be a broader conversation, not just about where you want to be buried and who you want at your memorial, but how do you want to live the end of your days? And I'm not sure if you're familiar with the whole medical aid in dying trend, but I'm a big proponent of having some freedom if you have a terminal illness to be able to decide when you leave the earth. There's a documentary on Amazon called Take Me Out Feet First. I had the director on my show a couple of years ago, but your parents may very well want that. They may very well not want that. But if you don't talk to them, then you don't know, and you're all kind of just guessing and waiting, which, by the way, creates stress. So having a plan in place, even if that plan changes, creates a level of comfort knowing that you are at least on the same page for the moment, right?
Yeah. I mean, and like you said, it's a very long, drawn out anticipation of when something might happen, right? And so as long as you have some sort of plan in place, you can always update it or modify it. But if you have nothing and you're starting from ground zero in a time of crisis, that's going to create so much more stress and emotional distress and feelings and just everything.
Exactly. You and I are so on the same page when it comes to that.
Yeah, absolutely. Well, Nancy, I think we've had such a good conversation. I'm so glad that we were able to get you on the show. For those of you listening, check out the Glowing Older podcast. It has very similar themes and different discussions around similar topics that I'm sure you would enjoy as well. So thank you so much for coming on the show.
Soon.
Yes, we will. Thank you so much, Nancy.
Perfect.
Thank you for listening to the Aging Together podcast. If today's conversation helped you, please follow the show, share it with a friend, or leave a quick rating or review. Your support keeps this podcast free, ad light, and growing. Until next time, let's keep learning and aging together. Take care.